Hello everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. I'm back with another NMC OSCE station for you for adult NMC OSCE exam, and this time I will be talking about one of your another clinical skills which have been added last November. So I'll be talking about the oral care plan clinical skill. Okay, so that's what I would be talking about in today's video. So if you like my videos, please press the like button now and subscribe to my channel. It just gives me a lot of motivation to keep making more videos for you. Okay, so let's talk about today's station. So like I said, I will be covering oral care plan clinical skill station for you, and I will be talking you through what kind of paperwork do you get, how to complete the station. Then we're going to work through a example scenario, okay, and write our answers at the end. So that's what I'm going to show you today. Okay, so this is a written station in your exam. It's a 8-minute station, so it counts for one of your clinical skills, but it is a written clinical skills. Okay, creating a oral care plan for a patient based on a scenario is a written skill. So it's a 8-minute written station. You will be given a scenario, and there are 4 possible scenarios. Okay, so you will be given 1 out of the 4. You will be given another thing. You will be given a oral health assessment tool, which will be partially completed for you. Okay, so it will be partially completed, but you have to add the score. So I will show you that health assessment tool within this video in few minutes. And next you will be, so your job is to correctly calculate the score on the health on the oral health assessment tool, and then go ahead and read your scenario and write your answers for oral care plan in bullet points. Okay, so you have to write 6 care action plan points clearly to pass the station. So that's what you have to do. So there are 2 parts to it. One is just calculating the score on the oral health assessment tool form, and the second thing is reading the scenario and answering, writing your oral care plan, at least 6 clear bullet points to pass the exam, pass this station. So that's what you have to do. Okay, so I did say to you could be possibly 4 different scenarios. So let's see what are those 4 possible different scenarios. So you can be given a patient scenario and the patient is admitted in critical care. Second thing is you could be given a patient scenario where patient has learning and physical disability. Third thing is you may be given a scenario where patient is on chemotherapy, and the fourth thing is you may be given a scenario where patient is on end of life pathway. Okay, so those are the 4 possibilities that you can come across in exam. So you have to prepare for all 4, and you will have one of the 4. Okay, so you will not get 4 different scenarios. You will get one scenario based on any of these topics. Okay, so let's look at the oral health assessment tool, which I told you that I will show you in a minute. So this is the oral health assessment tool form. It's been published by the test center. As you can see, it talks about different element of the oral health. What you need to do is you don't need to ask all these questions because it's a written station. So your briefing from your examiner will be that somebody has already asked these questions and have put the score for every element. Okay, so can you see the circles? There are circles on the form, so there will be a score in each circle. Okay, so your job is to actually add the score, and where you can see there is a total score box, so just write the total score there. So add the score from all the circles and just write in there. That's all you need to do. You don't need to ask any of the questions. The score is already given to you. Okay, so I will show that to you on a completed one in a minute. Okay, and then you will be given a scenario. As you can see, you have been given a scenario, so we will look at it in a minute. And next thing, we go and look at our marking criteria now. So that is important thing, because marking criteria is already giving you guidance how to answer, how to write a oral healthcare plan for any of the given scenarios. So you can see the marking criteria is split. So it has 4 different sections. One is for the critical care patient, one is for the learning and physical disability one is for the chemotherapy, one is end of life. So you already know the answers, so you just need to adapt to your scenario on that day and write the correct ones. So that's what you have to do. So you can go ahead and read this marking criteria, which is on your screen now. Okay, so let's go back to our scenario and the oral health assessment tool now. So let's go through the first oral health assessment tool. So as you can see, I've shown you that there will be number in every circle. So I have calculated the score on this one. I've completed it, so the total score is 5 for this one. So we will just do that total scoring. That's all you have to do. Now we're going to look at our scenario and write the oral health care plan. So let's look at our scenario now. So this scenario is that I've just made again, this does not belong to a real patient. I've just made this scenario just completely for the teaching purpose, just to say that as a disclaimer. So the Michael Smith was admitted to the medical oncology ward after having nausea, vomiting and fever post chemotherapy. Okay, he is improving after treatment but continue to feel fatigued and lethargic and has had some symptoms of mucositis causing pain. So that's the mucosa of his mouth is inflamed, okay, and is causing him some pain. So please complete the oral care plan with relevant information relating to the scenario. Please make sure your handwriting is clear, because it's a written station and legible. This is a silent station. You have 8 minutes to complete this station, and then they will just give you a sheet to write your answers. So that's what it is. So we have read the scenario now. So we have completed the oral health assessment tool form already. Now we just need to write the answers for this scenario. So for a patient who is on chemotherapy, again, the main things to remember is that yes, you need to do teeth cleaning and all that, but again, keep in mind that this patient can be in pain, lot of pain, and scenario is already telling us that that he's got inflammation in his mouth. So we need to be thinking about that. So let's look at our answers, which I have written here, taking the guidance from the marking criteria really. So first thing will be, we will write that we need to perform twice daily teeth cleaning with soft toothbrush if able to tolerate. If it's not causing too much pain for your patient, we will still encourage that we perform twice daily teeth cleaning with a soft toothbrush. Okay. Second thing will be to give twice daily chlorhexidine washes, again mouth washes if your patient is able to tolerate, because chemotherapy can cause a lot of pain. So we will have to, if your patient tolerate it, then to give twice daily chlorhexidine mouthwash if able to tolerate. Third thing is to give regular oral cleaning or hydration, okay, because the mouth gets very dry. So with ice chips or sips of water, so patient can just suck on the ice chips or just keep drinking sips of water throughout the day to keep the mucosa in the mouth really well hydrated, and that will reduce the inflammation as well. Fourth thing is apply oral moisturizer to the oral mucosa and also to the lip, and then lip balm to the lips every 2 to 4 hours because we already know it's quite inflamed. And then the next thing is consider use of artificial saliva. Now for a chemotherapy patient, they do have reduced saliva with all the treatment, so we should consider use of artificial saliva. Next thing is offer analgesia. That's really important because Michael has already got quite a bit of irritation and inflammation in the mouth, so offer analgesia to Michael as required. And the seventh thing is reassure Michael, reassess So reassure and the reassess. Okay, so reassess the oral health about I would say about 8 hourly. So you should reassess, say, and then if you need to change any of the plan or the inflammation is getting worse, then you can change it. But we need to reassess Michael's oral health every 8 hours. Okay, so that's the answer. So that's how you write. So again, so my top tips for this station is that make sure again is a written station that your handwriting is legible. Second thing is knowing your marking criteria. It's really important that you know your marking criteria for all possible patient scenarios. Okay, not just for one. We done one today, but just think about all other three as well, and then learn. Okay, so learn your obviously read your marking criteria, understand it, and know that if you have patient in different scenarios, how will you write those answers. Third thing is practice, because it is a quite quick station, 8 minutes, so practice with a timer that you know that you're able to write those answers in your exam. And fourth thing will be just adapt your answers to your scenario. Okay, look at your scenario and adapt your answers to that, because scenario is giving you some information, important information. Okay, so those are my top tips. I hope you like the video. If you do like it, please press the like button now and subscribe to my channel. You can also visit us on OSCEnurstraining.com, and also you can email us for more information about our OSCE training on OSCEnurstraining@outlook.com. We provide face-to-face training, we provide online training, we provide module training just for your APIs or your skills. So that's available. So if you would like to contact us, then contact us on the email address. So I would soon be back with another video for you. So bye for now.